Ladies and gentlemen, Dr. Lorenzo here. I am finally recording a video on arthritis here. Spinal arthritis or joint arthritis, osteoarthritis, which is a very common topic of questioning here in my main clinic's location, which is Tea Gardens, New South Wales. We do have Australia's oldest demographic here, so everyone wants to know a little bit about this. So I'm going to take the next couple of minutes to sort of talk about it a little bit more. Now, in a perfect world, this would be what your spine or joints would kind of look like. So uniform or symmetrical in nature, nice and beautiful, big, fat, plump joint spaces with a lot of room for all of these nerves and joint surfaces, so these like kind of articulating surfaces, etc., to move. Okay, so that there is your shiny new car, that there is your 16-year-old spine or a 16-year-old you sort of spine. Obviously, if you've had trauma and car accidents and things, it might look a little bit different. But as we tend to get a little bit older, this is more what it looks like. And you can sort of see you've lost that height of the joint. It's looking all mottled like a half-chewed minty. You know, there's not too much room for all those nerves at the back to sort of communicate and do their job. Now, this process is very silent. Just like most other chronic processes, like your cancers, your cardiovascular issues, atherosclerosis, cellular toxicity, the list goes on. It's chronic, it's a very silent kind of progression. So chronic means that it's traditionally lasted longer than, say, 3 to 6 months, in most case years. And it's silent in the way that you don't really feel it coming on. It's not really associated in the early stages with any kind of pain for the most part. So when people come to me and we've taken x-rays and they've got severe amounts of wear and tear all the way through their spine or severe amounts of osteoarthritis, it may not necessarily be associated with pain. So no, most people don't necessarily care about it. You know, if it's not broke, don't fix it. Well, think about it this way. These joint complexes, okay, this is essentially what your spine looks like. Now, if you turn and you look, imagine we're looking straight down the spinal column, right, in the middle there, your brain becomes your spinal, or your brain stem, which becomes your spinal cord, and that's essentially your nervous system all the way through that central canal, that guy there, and it at various levels comes out the back of the bones. Now, your brain and nervous system controls absolutely every single biological function in your body. The way that you respond to your environment externally and internally. So how do I respond to this world and the world around me? And how's my brain responding to the internal environment, what I've just eaten, temperature changes, all those different things. It's all regulated by our brain and nervous system. And the spine is essentially the grand protector. It's your suit of armor in many ways. So even though the process is quite silent and isn't necessarily associated with pain, doesn't mean that it is significant to your health and well-being. It is absolutely crucial to your health and well-being to make sure that this sucker moves well. Make sure that it's decompressed and it's, you know, even if you do have significant amounts of wear and tear and arthritis in the spine, that it's still moving. Imagine this as kind of like all the joints are locked up like a rusty door hinge, you know, and it's just meaning that you're not going to work 100%. If you had a spine like that or a spine like that, what would you rather? It's as simple as that. Now, this process, in my experience, is basically attributed to two different really important factors. One is your diet. Okay, most of us in the Western world will have a Western diet, which has a lot of sugars and additives and processed foods and things like this, which can speed up the process of what we call demineralization, or losing kind of minerals and the building blocks of your bones, which eventually leads to osteoporosis, which is almost like a wax-like kind of appearance, and it's just basically you're losing bone. It's crumbling before your very eyes. And number two is gravity. So the physics of your spine, I know we're getting a little bit complex here, the physics of your spine is really, 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 really important. So in most cases, people have a lot of compression going on. So every single second that you are standing or sitting, there is compression going through the spine. If that is allowed to continue without, any kind of external assistance, whether it's yoga, whether it's traction, whether it's chiro, osteo, some of these other processes, it's going to crumble at a greater rate. Now, there are certain techniques and things that we use. I use specialized traction techniques, long axis traction techniques, as well as using specialized traction blocks to decompress the spine and also to get the spine into a better shape. If you look at the spine or a person's body from the side, it looks like a bit of a S-curve, all right? Now, the reason that is because a curve is much stronger physically than a straight line. Now, unfortunately, with device use and bad posture and all working at a computer and all these different wonderful things, our spine is going to straighten out. So we lose those curves and therefore lose the inherent strength of the spine. So when people come to me and they have back issues, or they don't even really know that they've got back issues, they've got the arthritis, we normally do a bit of care to try and decompress everything first, get it working better first. You've got to unlock those rusty door hinges, got to settle all the muscles down, got to get some more hydration into the discs. And then we go through a process of re-strengthening and spinal rehabilitation. And that is the absolute best, gold standard, hands down way to manage these kind of arthritis. Now, I'm not necessarily talking about how you would chemically or medically look after the pain associated with them. If it's really extensive, then, we might have to introduce, other kinds of therapies, hot, cold therapies, anti-inflammatory therapies, etc. But first things first, get it working properly. I know it's been quite a long-winded video, but it's a really complex thing. It's really poorly understood, and people don't care because it doesn't cause pain. But this is like, this is quite important to a person like me with a mind like mine. So I hope that sheds a little bit of light onto this particular process, and get it checked out, get it sorted out. Don't wait until you're 60, 70, 80 and you can't touch your toes, you can't do a head check. Just a little bit of care, a little bit of work day by day. It's not going to cost you the earth, but it's going to save you your health. Get the body working properly is all I'm trying to say. Always get your body working properly. Engage with life. Enjoy your life, and you can't enjoy your life if you've got processes like that happening in the body, which eventually might lead to you injured or incapacitated or just not being able to function to your 100%. So for what it's worth, I believe that getting some work done on that, or looking after it yourself by way of yoga, exercise, Pilates, whatever, is going to be amazing for you long term. So thanks for watching, guys. Click subscribe if you haven't already. We'll try and get more and more and more of these videos out in the coming days, weeks, months, years. Thank you for watching. Catch you again soon. Cheers.